Uh, we are all talking about what kind of government policies should be done. So we have a presentation that what central government has done since 2014 to 2022. And actually this presentation is meant for 10 minutes, but as I understand that all of you, we are short of time. So I'll try to finish off in 5 minutes. If it's 4.5 minutes I can finish, I won't go to 5 minutes. I'll just start with the presentation. Thank you. Because a lot of questions are being done, but we are not aware what central government has already done. Yeah. So to understand what central government is doing presently, we need to understand how present government is implementing this policy. So this policy has been proposed to the central government in, these are not today's policy. So in 1999, the health ministry had two departments. One is modern medicine and second was Indian Board of Systems, that is Ayurveda, Homeopathy, Unani, Siddha and Naturopathy. Next slide. So in 2002, Arogya Bharati proposed a program for National Health Mission, that how the whole nation's health should be, and based on that proposal, when Atal Bihari Vajpayee was a Prime Minister of India and Sushma Swaraj was Health Minister, this proposal was given. Next. So Murli Manohar Joshi ji, who was representing the BHU, he gave the proposal that we should have a program for 55-60 diseases, which is declared non-communicable diseases by WHO. Those diseases should be treated by Indian system of medicine, and this proposal was in 2002. Next. So in 2003, Government of India has created Ayush, that is Department of Ayush, where A stands for Ayurveda, Y stands for Yoga and Naturopathy, U stands for Unani, S stands for Siddha, and H stands for Homeopathy. Next. So in 25th September 2003, the central government has passed one GO in which acupuncture and hypnotherapy was added as a mode of therapy in India. Next. So 2004 to 2014, because the central government was ruled by Congress government, and Congress was never interested in promoting Ayurveda, as Ayurveda has its roots in our Hindu Sanskriti, that is Sanatana Sanskriti. So there was no much work on it. But 2014, again when the BJP came back into the power, all the initiative which was taken since 2003 and 4 has been carried on. So in October 2014, central government created Ministry of Ayush. Previously it was Department of Ayush, then it created Ministry of Ayush, and Shripad Nayak ji became the first health minister, Ayush minister for India. So we are all celebrating this Dhanwantari Jayanti. This started in India celebration since 2015. On the same year, on 21st June 2021, on international level, Narendra Modi ji took yoga, and we got a recognition of yoga across the globe in 2015 on International Day. That is 21st June. And Dhanwantari Jayanti also we started celebrating, which falls just 2 days before the Diwali. We call it Trayodasi. So in 2018, central government proposed Ayushman Bharat Yojana, which has two components. The one component is for the poor people who cannot afford health care. So 5 lakh, next slide. So it has two components. The one component of 5 lakh rupees, where every poor family gets 5 lakh rupee coverage for entire family per year. And the another component is that all the public healthcare sectors, or we call it as primary healthcare centers, it was upgraded to health and wellness center. And now this health and wellness center has all Ayush doctors, and the budget for this is 1200 crore per year. Next. Now since 2016 to 2019, if you look upon the total seats of medical colleges in the Ayush, it is almost double compared to 2014. Next. Wait. Yeah. Santosh ji, please come. Santosh Atri ji, please come and have a seat. Huh? Yeah. He is an NMC National Committee member. Santosh Atri ji is doing a lot of activities. Priyadarshini, please welcome Santosh ji. Thank you. So now we are talking, as we have all talked about COVID-19. So what central government has done, COVID-19, I just say in 2 slides. Number one, when the whole world was seeing COVID-19 as a threat, the government of India decided to include Ministry of Ayush into the management. Next. And central government had created 11 ministries central committee which was chaired by Prime Minister Narendra Modi ji himself, and the 11th ministry included Ministry of Ayush also to combat COVID-19. Next. So the government of India had launched 2 mobile applications, one for the allopathic system, that is from Health and Family Welfare, Arogya Setu app, which all of us we know, but there was another mobile application launched by Ministry of Ayush, that was Sanjeevani app, because we are all in the lockdown, and what to do during lockdown, that has been given in this mobiles. Now, the Ayush Ministry, this is the first time happened in India when a COVID-19 or any pandemic, the Ministry of Ayush or the Ayush medicine was included, and it was not included only for prevention, but for mild and moderate, and few BJP ruled states, it was inducted as an emergency management also for ICU. So on the occasion of 5th Dhanwantari Jayanti, that is in 2021, last year, Narendra Modi ji had inaugurated the first institution in India, INI. This is the first institution after independence where Ayurveda has got a recognition the way we have aims in modern medicines. A similar way, Ayurveda has created INI, that is Importance Institute of National Importance. And next, on the same day, Narendra Modi ji has inaugurated one deemed university in Rajasthan, in Jaipur, and they created the first integrated healthcare center in Jaipur, which is doing the research and development on integrated medicines since 2021. Next. So based on the work done by Ministry of Ayush on COVID-19 research, the WHO has recognized it, not only recognized it, but now WHO has made India as a headquarter for all the research and development of entire world in India, and that center has come in India. So this is a proud moment that whatever COVID management we have done it was not done by anybody in the world, and it was all happened because of the able leadership of Narendra Modi ji. Next slide. So this inauguration, this headquarter of traditional therapy was started on 22nd April 2020, where WHO Dr. Tedros himself had come in India and he inaugurated this center, and from this year, the center has become effective. Next. So now, this is all I talked about, what central government has done for Ayush, but now I would like to say what has been done. I'll just finish in next 1 minute, only 6 slides, and whatever central government has done. So 3.28 crore beneficiaries of Ayushman Bharat Yojana, and central government has spent so far 37,606 crore rupees. 1.18 primary healthcare center is already started under Bharat Wellness, Ayushman Bharat Health and Wellness Center. 8,727 Jan Aushadhi Kendra. 5 crore plus mother and child vaccinations, which is under Mission Indradhanush. 15 new aims has been launched by Government of India, and 2.7 crore Indian citizen is getting beneficiary of Amrut pharmacies. 200 crore, and this is the first time that we have 200 crore plus vaccination doses, and we have 22 crore plus digital health card in India, which was not existing before 2014, and 50,000 ventilators, which was manufactured in India, and this was circulated under the PM Care Funds. Before 2020, India was not preparing any single PPE kit. Now we are preparing 5 lakh PPE kit per day. So from zero on March 2020, we have come to 5 lakh kits per day. Central government has created a principal scientific advisory board, which has around 1,500 people. So to advise in different aspects of government policies, including different ministries, this body works for it, and the chief of it is Ajay Kumar Sood. 2.34 crore teleconsultation was done by March 2022. Next slide. So this is last slide. So for the dialysis, Indian government has given almost 700 dialysis machines, almost per district, one dialysis machine should be there. And the paid maternity leave has increased, as all of us we know, that the health of the woman and the health of the upcoming generation is very important. So government has taken an initiative of giving the maternity leave of 26 weeks. And finally, it's a Poshan Abhiyan. Because of lack of time, I'm unable to describe, but I think all of you can read this because it's all available on the website. Thank you.
Thank you, Jignesh sir, for your valuable inputs. Making India from a depending nation to dependable nation under Modi's government is really appreciated by every citizen of India.